February is Heart Health Month, and there is a lot you can do to bring awareness, like learn CPR, you can wear red, and you can share resources in your community. We want to do that today by learning more from our 9 News medical expert, Dr. Paul Coley.
Dr. Coley, thank you for being here.
Happy Heart Month.
Happy Heart Month. You're
And you're red.
appropriately dressed in red. We love it. I got my little red pin on.
I love that.
We all try to go to our regular.
Nice.
We need to get you one too, Alex.
Yeah, you need a pin.
We all try, at least I try to do my regular checkups, right? Check the blood pressure, things like that. Is there anything more we should be doing to help find these risk factors or hidden risk factors?
Here's the thing. So we thought checking blood pressure, managing cholesterol, managing blood sugar, that was enough. And then we realized 50 to 75% of heart attacks can happen in people with normal cholesterols. So clearly there's something we're missing. And that's when we discovered this, what's called hidden or stealth cholesterol. Everybody's born with a volume on their stereo of this marker. It's called lipoprotein A. The people that are elevated have a 2 to 3-fold higher risk of heart attack, stroke, and heart disease. And it's not checked on your regular panel. So you actually have to ask your doctor for it. It's entirely genetically determined. So exercise, diet, none of those things can really help it. So you really have to make sure you're not one of those 20% of people with the volume turned up. Because if you are, then your cardiologist needs to do more to kind of counteract your other risk factors.
So if it's not on the routine panel, I usually think I go in there, the doctors are going to do what they're supposed to do. I'm good, you know, but now knowing that you have to kind of advocate for yourself, is this something you should be getting every year that you should ask your doctor for?
Nope, so just once in your lifetime. So just write down the test, and because it's genetic, and because we don't really have medications yet to modify it, those are in the works, we might have that next year or the year after, but we really just use it as a way to determine your risk. We use it as a way to determine your risk if you're about to have a pregnancy, because women who have elevated lipoprotein A going into pregnancy are more likely to have pregnancy complications, so we might start them on an aspirin. If you're an older person that has a higher level of this, we might start you on an aspirin. So just make sure you write it down, get it checked once, and then once you check it, if it's normal, you can forget about it. If it's high, you got to get all your family members checked, your siblings, your kids, your parents.
Very important advice. What about cholesterol?
Yeah, so this is a hidden cholesterol. There's also an inflammation marker. So I want you guys to think about this too, because the American Heart Association, American College of Cardiology have just released a new consensus document that now says it's not just enough to look for cholesterol and blood pressure and blood sugar. We now need to start looking for inflammation. So the way we do that is a blood test called high sensitivity CRP, HSCRP, and that tells you very specifically about blood vessel inflammation. But here's the tricky thing. You can't check it after you've had a cold. You can't check it after you've had a night on the town partying and drinking, because inflammation goes up. So you want to check it when you're feeling well, nothing has happened, and then you want to check it twice. So you want to make sure you check it again a few weeks later to really prove to yourself that you're persistently elevated with this marker of inflammation, and make sure you don't check it when your diabetes and your kidney disease and your blood pressure, all those things are not well controlled.
And those are blood tests. What about scans? Because I know that, I mean, there have been so many strides made in that technology. Can you just scan your body to look for blood or heart disease?
Yeah, so there's a very specific scan starting at the age of 40. Now we put women at 40 to get mammograms, but we don't look for heart disease, even though that's more common. And one of the biggest challenges we've had in cardiology, we've been making up heart disease risk. We say, oh, you have this risk factor, we put it into a calculator. Why not look for the disease itself with a heart scan, like you said, Alex? And so this is called a calcium score. You can get it out of pocket for $99, and during Heart Month, they often have specials. If you're over the age of 40, you need to get a calcium score. If you're already on a statin, you can get a calcium score, but keep in mind that the statin may affect the interpretation of your calcium score. So make sure you talk to a doctor about it. And this is one of those tests you want to get a 0 on. So if it comes out 0, that means you have no hard calcified plaque or blockages.
Good to know. I've never done that. And I'm 45, so I'm glad that you're mentioning this.
So maybe this
now.
month you'll try to do it.
Yes, I think that's very important. What about urine tests? You mentioned earlier to me that there's a urine test that you should also ask your doctor about to do once a year.
Yep, so this is for people who have heart disease, who are overweight or obese, who are diabetics, or who have high blood pressure. We spend so much time looking in the blood, we forget to look in the urine. Now, our kidneys filter our blood, right? They do a great job of filtering our blood. But long before they start showing that they're unable to filter your blood by dropping that value in your blood, the filtration value, they start to get stressed and they leak a little protein in your urine. So getting a urine test once a year to look for something called UACR, urine albumin creatinine ratio, and your doctor will know this, just say UACR, write down the name of the test. that will tell you sometimes 10 years before the kidneys have started misbehaving that they're getting stressed and you need to do something better.
Important information. All right, Dr. Coley, thank you.
Thank you.